Are you curious about how something as simple as journaling can help you deal with physical pain? Well, if you are, you want to hear this interview because today I've got with me a gentleman who's going to talk about personal experience dealing with just that. And we're Margaret and Eddie, and we're a mindful emergence. And what we do is we bring mindfulness, movement, and breathing practices to you so you can use them for your own healing and personal transformation. And most of our work is with plant medicine. So today, Margaret and I are joined by Bennett Harris, who's a psychiatric physician's assistant and psychotherapist committed to the exploration of human consciousness. He spends a great deal of his work and free time in the pursuit of the present moment. And I will also add, I'm very happy to say that Bennett's a good friend of ours, and we've really learned a lot from him over the years. So thank you, Bennett, and I'll turn it over to Margaret.
Hey, Bennett. Bennett's got some great information that he wants to share about journaling. So, Bennett, we know that journaling is a really good self-care practice for getting in touch with our emotions, writing them out on paper. But can you speak to us about its physical health benefits?
Yeah, I think so. First of all, thanks for having me, guys. Good to see you as always. Um, so I think my personal journey with the health benefits, the physical health benefits of journaling goes back to starts around Thanksgiving of 2024, so last year. Um, I was perusing YouTube and looking for some sort of magic elixir for my elbow. So I had this left elbow pain from what I thought was repetitive strain use or overuse injury for a long, long time. And so, not to get too technical, but if your elbow hurts on the inside, we call it golfer's elbow, and if it hurts on the outside, you call it tennis elbow. In case you were wondering. So this lateral or medial or inside elbow pain typically is very stubborn and it can be very recalcitrant, hard to get rid of. And I've had it on and off for years. And several summers ago, it flared up to the point where I couldn't do a lot of things that I really love to do, including rock climbing. So I take months off. The interesting thing is that with a lot of tendinopathies, rest doesn't actually help them at all. It's more of an active process of recovery, and sometimes it takes months or years, and sometimes people never recover, unfortunately, from tendinopathies. So there I was, probably 10 o'clock at night, looking for the next video for my elbow, and I came across a guy who said he was a professional video gamer and a great job, right? And he played, I guess he thought his elbow pain came from playing video games too much. So he went, he had tried all this stuff. He tried the PT interventions and seen a doctor. I think he even had like a steroid injection in his elbow, temporary relief. And he said, I read a book and my elbow pain went away. And that was intriguing. So that led me to the start of this venture that eventually took me on to journaling, and which curiously enough has helped my elbow a great deal, but also has had unexpected other health benefits, including a total relief from left knee pain that I had been feeling for a decade.
How do you think that happened? What was the clue?
Um, well, I mean, so I started by learning about this guy named John Sarno. He was covered on 2020 years ago, and he talked a lot about mind body medicine. He wrote a book called The Mind Body Prescription. And his theory was that suppressed emotions, or even really what he called repressed emotions. So, for those of the listeners not intimately familiar with all the ins and outs of psychobabble, if it's suppressed, you consciously aware that you are pushing it down. If it's repressed, you're not. So it's been subconsciously repressed. And he said that most people don't realize that they have all these repressed emotions that go back to childhood, which is where they learned most of this, most of these unfortunate coping mechanisms. And that, because they push these things down, um, the body recognizes them or the brain recognizes them as a threat. So, okay, so we're really avoiding these for a reason. That means we really don't want to feel these. And then, therefore, the body will manifest a symptom to distract you away from noticing those strong emotions that it really doesn't want you to experience. So that's sort of that was the start of all this back in the 1970s, and he didn't really have a whole lot of imaging or scientific or empirical data to back that up, but nowadays they actually do. So anyway, I started learning about him, and then I learned about a young lady that went to see him. She was 19 years old, and she had debilitating back pain. And she went to see Dr. Sarno, and of course, she had the X-rays to prove that she'd had this degenerative disease or a condition in her back called degenerative spondylolisthesis. She goes to see him, and he says she said that he picked up her entire chart and threw it in the trash and said, "That doesn't cause back pain. You have repressed rage." And she, of course, because it's repressed, she had no idea. She said, "I don't think so." And he said, "We'll see about that." And she started journaling, and boom, the dam broke at a certain point. She journaled for several months, and I think she's in her early 50s now, and she's not experienced any back pain at all for several decades,
Mhm.
completely symptom free, but just through journaling and feeling her emotions through journaling.
So
And
there's a
so I started to do so.
You started to do so yourself. Yeah, yeah. There's a great expression. I don't know who came up with it, but it goes, if I don't know how I'm feeling and I write about it, then I realize that through the action of writing, I'm getting in touch with my feelings. So, how did you get in touch with your feelings through writing? How did that come about?
So I'm kind of an inquisitive person in general, and so I learned about this guy, and then on YouTube. I watched the 2020 episode on him, and kind of blew my mind. So of course, I go down the YouTube rabbit hole, and I find some stuff that looks pretty credible, and some stuff that's not. I like to consider myself a scientist, so I try to be kind of critical about what kind of data I consume. And anyway, I came across her. She's a licensed clinical social worker, so she's a legit therapist and has been for a long time. And she has a type of journaling that she recommends called journal speak. And so I just followed the prompts and I started doing that. And that's so interesting what you just said. I never thought about that, but that is absolutely correct because as I started to write about things that I knew had happened and things that I knew that I felt a certain way about, it was amazing how much was still there. And the effect that that had on my body even immediately. I would write and get sometimes very dysregulated, to be honest, and I would cry and even weep, and sometimes I would shake and I would convulse, and I did had an episode where I vomited, and I was just like, wow, I can't believe that something that I barely knew was there has been affecting me this much.
Wow, yeah. And the act of writing just brought those experiences up from the cells in your body so that it became obvious to you.
I got a quick
Yes.
question. Did you put pen on paper or did you type?
So I actually typed, and the reason I typed is because she recommends for her type of journaling practice that you delete or you burn or you destroy after you feel. So I would type it all out, and then I would sit there on the couch, and I'd really feel it. I became it. I didn't exactly look forward to doing these, but I knew that I wanted whatever this was. I wanted this out.
Yeah.
So I would sit on the couch and type and feel it. And once I felt like I had to release, or quite frankly, it had about all I could take for that night, I would delete it and then listen to some soothing music or something that was kind of like bilaterally stimulating back and forth between my left and right ear. And I did that more days than not every week for 2 or 3 months, probably 3 months, and um, it got easier and easier. And I started to notice a lot of really positive effects, including a lot less pain in my body. And this is the thing that has been the most amazing so far. That we believe certain things that people tell us that might not be true, such as when we get old, we just fall apart and we hurt all the time. And so I think that a lot of that is cultural. And so we believe that if you're over the age of 30 or 40 and you ride in a car for 2 or 3 4 hours, that you get out and your back hurts. Everybody, oh yeah, my back hurts, and I drive in the car for too long. And that really never made any sense to me because you're just sitting there. What kind of damage is that doing to your body? It just doesn't make sense to me. And one of the things I started to notice as I was journaling more and more is I could get in the car and drive to Chattanooga or Slade, Kentucky, which is 4.5 hours from here. I get out of the car, my back wouldn't hurt. And that's the first time I had felt that way since I was a teenager.
You
So a
changed
lot
your beliefs and you changed your physiology.
changed my beliefs. I don't believe that stuff anymore. I don't believe that just because you sit in the chair for an hour that your back has to hurt. I don't buy into that because it doesn't make sense.
Mm-hmm. So interesting. It seems as though when we put pen on paper or we type in a computer and then delete it, that's a great idea as well. We get what's inside our head or sitting on our heart or in our hips or wherever it is. We get it out onto paper or out onto the computer. We can see it in the clear light of day. We know what that is. We feel it in our body, and then we don't have to carry it anymore.
Mm, yeah, I think that's
Hmm.
right.
Hmm.
There's a likeness too, even now, if I think about some of the things that I journaled about, there's a likeness to some of those memories now. I can think back on them. They seem unfortunate. They don't elicit the same type of gravitas in my body that they did whenever I was writing. I could just, there's a likeness there. It's hard to explain, really.
That makes
So maybe that's,
sense.
When you say that, it reminds me of what, because I've done trauma work like somatic experiencing and EMDR, and the result was the past memory that we were working with hasn't gone away. It's just lost its charge. That sounds like a similar thing that you're talking about.
Hmm.
yeah, it is a very similar feeling because I'm both an EMDR. I haven't practiced as an EMDR therapist in a long time, but I'm trained in EMDR. But I was also the client of an EMDR therapist more than once, over the past 20 years. And yeah, it is kind of a similar likeness. You're right. It doesn't feel the same way.
So there's science behind
There's different.
this process that you've been doing.
Mhm. There is. There is actually, yeah. So I really took a deep dive into that and started because of the nature of my work. And I felt this was so helpful for me that it was almost criminal not to at least let people know about it. So even when somebody comes in for a new intake with me in my work, I tell them about this stuff. Hey, look, that this was, this wasn't just helpful for me. This has been helpful for a lot of people, and we have, functional magnetic resonance imaging now. So the difference between an MRI and an fMRI is an fMRI can tell you what your brain is doing right now. An MRI can tell you what it kind of does, but an fMRI tells you what it's actually doing in that moment. So we have those scans now that show that this causes real brain changes.
Hmm. And the wonderful thing that I hear you saying is that it's pretty trauma informed, meaning that you determine how long to write, what to write. You have a tool afterward that you have in your mind that you can kind of soothe yourself. And you could put that pen down or stop the computer, delete at any point. So it's pretty controllable by you individually and private. And, if you set aside some time, you can feel your feelings. And if there are some physical symptoms that are uncomfortable, you can be with them and then allow yourself to find that soothing kind of rebalance.
Yeah.
Yes, yes, and I'd also add that there are things that I wrote in my journal in the way that I said them that I would never say that way even to a therapist. I would edit
Yeah.
them. There's just the rawness to how it came out.
Yeah.
And when I talk to other people about journaling, like just there's things that you know you want to say, but you just won't do it because you feel ashamed or like you're a bad person if you put it that way.
Uh-huh.
And you cannot edit it. You can't censor it because it really needs to come out and be fully felt in your nervous system.
Yeah. And
It's
even if you say
truth.
to yourself, I'm not a bad person for feeling this way, you sometimes you don't want to write it down. I think that's a fear for many people. They don't want it to be found. They don't even want to acknowledge it. But I think you did a really courageous and compassionate thing for your soul and your body by being completely honest with yourself and fearless to some
Thank
degree.
you.
So
To some degree. Well,
wouldn't it be cool if there was some ready-made journal, Margaret, that people could use? It's so
So,
interesting. Go ahead and grab the book, Margaret.
yeah.
We had this conversation recently, almost to a day when Margaret's book she just created came out.
Yeah, I came out with a journal. I call it micro writes. So my idea is to write in just short chunks. And there's four sections in here. The first section is around self-compassion. So there's journal prompts and some inspiring quotes and some suggestions. Self-care is next. Self-acceptance is third, and self-love is the final piece. So the suggestions contain micro breathing practices and micro movement practices and micro meditations. And so you can write in short little nuggets and you can take your time with it.
So we'll
I
put
think it's great. Sorry, go
I was just going to say, well, I'll put the link if people are curious about that in the description that comes along with this video. If you want to check out the journal, it's on Amazon. I've looked at it; it's really beautifully done. Yeah, thank you, Margaret, for creating it. Anything else you want to add? Is there a question that maybe we should have asked you that we didn't that would be important to mention? Anything about?
I can't think of any, but what I was going to say, I had a chance to look at that journal a few nights ago too, and one thing that I really like about that is for anybody out there who is neurodivergent, it's clean and the brief assignments are really palatable and chunkable for somebody who has ADHD or somebody who really struggles with, starting things because they feel like it's going to take forever. Or if anybody has a sense of dread around starting a process, I think something like your journal is very approachable.
Thank you. Yeah. And you don't have to journal every day. You may journal once a week and just pick it up when you feel there's a big emotion that you want to get in touch with. And that'll keep your body feeling cleaner, freer.
Well, when
Agreed.
we had dinner the other night and you shared that story about it, I was blown away. I mean, I knew that journaling was powerful, and I know that trauma and stuff is stored in the body. But when you talked about how you released all this stuff just through writing,
Yeah.
wow. And that's impressive because you kept doing it even when it was really hard. You knew what you're going to be facing was going to be difficult, and you stayed with it because you really wanted the process.
Yeah, I think it's about how you interpret what's happening.
Yeah, yeah, exactly. So anyway, I want to thank you for joining us, Bennett and Margaret. Thank you for doing this interview. And if anybody who watched this has a comment, please leave the comments, and I can send them along to Bennett if you have anything to say to him. And obviously, if you like the video, give us a thumbs up. If you like this kind of content, then you should subscribe and hit the notification bell so when these videos come out, that you'll know about them and can watch them. And thanks for all of you for watching, and see you next video.